Distinguished Dr. Douglas Noble, distinguished academician Qiao and speakers, dear participants and colleagues, greetings from Beijing. Welcome to webinar, Universal Health Coverage and the Coronavirus Crisis, Challenges and Responses, Maintaining Essential Health Service for Pregnant Women and Children while Responding to COVID-19, co-hosted by UNICEF China and International Health Exchange and Cooperation Center, National Health Commission of China. I'm Wang Jian from the Center at HECC. Today, Dr. Douglas Noble, UNICEF Deputy Representative to China, and I will be the moderators. This is the 19th webinar of the Social Protection Response to COVID-19 webinar series. The webinar series is a joint effort inspired by colleagues and organizations working to disseminate and discuss the most recent contents on social protection responses to COVID-19. COVID-19 is the most impactful global pandemic the humankind has suffered over the past century. All countries have taken strong prevention and control measures based on their respective conditions. Here, I'd like to take the opportunity on behalf of our center to express condolence to the victims and extend our highest respect to you, dear participants of the webinar, and all the experts, health workers who have kept fighting on the front lines of the pandemic prevention and control. The center at HECC I work for, ever since its establishment in 1982, has been committed to promoting universal health coverage, both domestically and globally. As a strategic partner of UNICEF China, we have always been paying great attention to maternal and children's welfare, especially during the period while the health system is under high pressure from COVID-19 pandemic. How to maintain the MCH system by strategic planning, tactic optimization, resources mobilization, and action coordination. That is the same challenge all of us are facing. China took the hit from COVID-19 earlier than other countries. Therefore, we have made some beneficial exploration on maintaining essential health services for women and children, while conducting pandemic prevention and control to block the spread and save lives. During the pandemic, Chinese health authorities took actions in a timely manner and established a series of national policies and technical guidelines. Through risk evaluation, strategy setting, innovative services, and comprehensive health education. Accessible basic healthcare services, including prenatal care, safe delivery, neonatal and child healthcare, nutrition, mental health, etc., were guaranteed. At the same time, we prioritized nosocomial infection control to protect health workers and patients from infection, and established a set of guidelines on safe delivery assistance, child and maternal COVID-19 pandemic prevention and control. Now, we are willing to share challenges and lessons we have learned from the tough fighting. Also, we are eager to learn valuable practice from you, colleagues, and peers from other countries or organizations. In regard to some tough issues still remain unclear, may we join hands to find solutions by further collaboration. Based on this vision, with great honor, we invited participants in MCH policymaking, MCH service providers, experts on health education and treatment for COVID-19 infected women and children to share their experiences from different perspectives. The 4 speakers are Professor Wang AiLing, Director of Maternal Healthcare Department, Women's and Children's Center of Chinese CDC. Professor Huimin, Chairman of Guangzhou Women and Children's Medical Center. Professor Ying, Director of Health Education Center of Chinese CDC. Academician Qiao Jie, president of Peking University Third Hospital. Thanks for your time. After presentation, there will be a 20-minute Q&A session. We encourage the audience to send questions to the panelists through the webinar. Your active participation is warmly welcomed. Now, let's move to the presentation. The first speaker is Professor Wang AiLing. She has been committed to maternal health care, prevention of mother-to-child transmission of HIV, syphilis, and hepatitis B, and responsible for drafting national plans, technical guidance, training, supervision, and evaluation, and other technical support work. She has participated in a number of research and international cooperation projects. Let's welcome her to share with us how China's MCH system provides services during the COVID-19 epidemic. Professor Wang, please.
Good evening or morning. Thanks so much for International Health Exchange and the Cooperation Center and the UNICEF invitation. It's okay? Thanks so much for Director Wang Jian and Dr. Douglas. It's my honor to be here to have the opportunity. On behalf of Director Song Li, I will share the experience how does China's maternal and children's health system provide service during the COVID-19 epidemic. There are two, next please. Thank you. There's two parts in my lecture. Firstly, I will give brief summary the situation about maternal and children's health institute from health providers' perspective. The second part is about optimizing the operation of MCH system service system to adopt the changing situation during the outbreak. Next, please. Next, please. From health provider perspective, this epidemic makes us have only experience. Recording the feeling at that time is very complex. For MCH hospital, they have more pressure on prevention and control requirements this infections disease. They have to change the diagnosis and treatment procedures according to the situation. For prevention and control requirements, the institute need more protection equipment for their clients and staff. I remember at the early February, there was some lack of masks and protective clothing in some hospitals. Fortunately, this situation soon improved as supply increased. Next, please. The second, next, please. Next, the second point is most hospitals should face the situation that there were few operation visits than before. Some antenatal care and children care changed to online and other ways to get medical help, but the need for delivery and critical illness still exists. This kind of needs cannot be delayed, even in the event of the outbreak. So the hospital must be well prepared, whether it's from the medical staff or for facilities. About the points, how the MCH policies the service during the output, I will introduce it from the perspective policy and advance. For the first thing is policy. At the early February, Department of Women and Children Health, National Health Commission of China published the national policies and technical guidelines on COVID-19 prevention and management among pregnant women and children. One is published on 22nd of February, and one is released on the 8th of February. This published notice on how to prevention and management infected pregnant women and children during the outbreak of COVID-19, and also point out the stringent management of pregnant women and ensure safety of motherhood during the outbreak of COVID-19. Next, please. Next, please. Next, please. Yes, thank you. With the implemented of no, last one. Combine? No, just come back, please. Not this one. 我不能控制它啊，它翻太快了。Could you back please? Back, please. Could you change another one? Last slide. Okay, thank you. With the implementation of quality policy. No, next one. Next, please. Next, please. Yeah, this one. Women and children minimize the time visit to hospital. Normally, they will be protected well by their family member. Women has been infected. In responsible to the physical and psychological points of pregnant women during the outbreak of COVID-19, health firstly were required to providing more support on antenatal care and mental health. Next, please. Which were done through viral. Next slide, please. Okay, this one. Requires providing more support on antenatal care and mental care, health, which were done such as online consultation, WeChat, and other social media apps, hotline, and video. We also had a range of activities of health education aimed at the general population. The main goal is to tell pregnant women and children how to protect themselves and how to see a doctor. Next, please. Could you, okay. At the same time, more targeted services were provided to pregnant women and newborns. In this introduction, I pay more attention on maternal health because maternal health is under great pressure in the course of epidemic. The other reason is the safety of maternal and newborns' health always our priority to care. As a routine management for pregnant women, we do screening and assessment of risk of pregnancy. Use 5 colors to show the assessment result. For high-risk pregnant women, we give them system management. For near-miss pregnant women, we have a set of rules and guidelines to try to salvage what we can. Also, we have a rule on accountability of maternal and children's infant safety. The last The last point is the role on case report to the individual maternal health. We do this. We call this 5 rules on the safety of mother and infants. These rules still work on the epidemic duration. Health facility were required to set up separate rooms for maternal care clinics and obstetric wards so as to minimize the risk of infection of pregnant women. For us, health facility and for pregnant women. Next, please. Next, please. This graph shows the raw process of screening, assessment, and deal with pregnant women. both at the time and in the institution. The pregnant women with COVID-19, we management the pregnant women follow the purple color. In China, we have already a set of management methods to provide service for getting information disease pregnant women and their infants, like HIV, syphilis. The pregnant women with COVID-19 are also infected cases and also follow the purple color to provide related service. Next, please. Could you next, please? For low risk pregnant women, they were advised to adjust their schedule for maternal care visits and consult with their doctors on how to protect themselves and conduct health monitoring at home. For pregnant women with complications, they will suggest provide to how to conduct antenatal care visit as scheduled, and under the situation, they could go to hospitals. Next, please. Okay. In order to ensure timely direct and treatment of infected pregnant women, a service prevention system for screening, diagnosis, and treatment of pregnant women with COVID-19 were established based on the existing MCH system. Next, please. About the infected pregnant women and infants, all cases should follow the national protocol of management, treatment, and follow-up. We quickly established several experts global groups on the basis of our original experience. Experience groups composed of obstetricians, pediatricians, physicians, especially in respiratory infection disease, and ICU were included in all areas across the country. They participated the management of near-miss pregnancy with COVID-19 infection. For newborn of women with confirmed infection, isolation and specific newborn care were required, and the newborn under severe condition were required to be referred to designated hospital for further treatment. We have some designated hospital in every city at the COVID-19 epidemic. Next, please. Inclusion. For how does China MCH system provide the service during the COVID-19 epidemic? There were three main points to emphasize. One is timely release national policies and technical guidelines on COVID-19 prevention and management around pregnant women and children. The second point is we optimize the operation of MCH services system to adopt the changing situation during the output. The last point is strengthen prevention of maternal and children's health service through different channels and platforms. Today, I just briefly introduce the major practice from MCH perspective, especially pay more attention on maternal health. There also have lots of practice on children's health, on reproductive health. Due to the limited time, I have not been able to make a special introduction. More couldn't say too much. Finally, I want to appreciate the International Health Exchange and Cooperation Center and the UNICEF Beijing office. We would also like to thank my colleagues who have fought in every position for women and children's health since the outbreak. Thanks all.
Thank you, Professor Wang, for your excellent presentation. Accurate, situation-based or demands-oriented optimization of the operation of MCH service system, from timely policy response, technical guidelines release, to target services provision strengthening, very impressive. The three key points do play a great role in the fighting. Thank again, Professor Wang. Our second speaker is Professor Huimin, Chairman of Guangzhou Women and Children Healthcare Center. Professor Xia is an expert in neonatal surgery and pediatric general surgery. The center under his leading is designated as the treatment center for COVID-19 infected children. Let's welcome Professor Xia to share their experiences in MCH service delivery during the COVID-19 pandemic. Professor Xia, please.
Thank you, Ms. Wang, for your kind words. I'm glad to take this opportunity to share you our experience about. We'd like to share our experience in maternity and children health service delivery during COVID-19 pandemic in Guangzhou. Next slide, please. Can I ask next slide, please? As you know, my city is in Guangzhou. We're located in the south part of China, and we are Guangzhou Women and Children Medical Center. It is one biggest children's hospital and maternity hospital in this region. Next slide, please. May I? Next slide, please. Thank you. And first, COVID-19 infected children come to our medical center in 19th of January this year. Until last month, more than 900 children has been screened in our fever center. Among them, 65 children highly suspected being infected by the virus has been qualified in our medical center. 24 cases have been clinically diagnosed as a COVID-19 infection. 10 of them without any symptoms. Next slide, please. What we have learned from this group of patients, and three key findings from epidemiology and clinical character has been issued. The first thing that what we have learned, and all the cases that we have is found a vertical excretion has been clearly detected from the gastrointestinal tract. Some of them even stay longer than the respiratory tract. This reminds us probably the oral fecal infection is possible. And even they have stayed longer than the respiratory tract. That is also to remind us maybe we had to make sure and the patient before discharging the hospital and should be oral swabbing and anal reactant swabbing should be negative in the same time. The second finding that we have recognized that CT scan is more sensitivity than chest X-ray, even in without any symptoms, without any symptomatic children. The third finding is mostly interesting. All the children has been diagnosed in our hospital. They are originally come from family cluster. There was no single children to children and children to others transmission. Next slide, please. Based on scientifically funding, we have developing comprehensively strategy, clinical pathway, and the treatment protocol. Our excellent medical team to provide best treatment for all the children that stay in our hospital. After closed loop management for diagnosis and treatment, so we try to provide the best treatment for all this group of children. So all children in the hospital have fully recovered. There was no single children has been needed to send to the intensive care unit. There was no single children need mechanical discovered. Next slide, please. Another issue that should be paid very important attention, and not only protect the children with infection, but also have to carefully protect all another visitor to prevent the various surprise. So several steps are very important. Educate the visitor. Make sure keep social distance, wear a mask, and wash hands. In the hospital side, we have separate the quarantine area to maintain some. Next slide, please. Next slide, please. So make sure each medical staff has been very carefully protected. Are also certain issues that we are very concerned. So ensure PPE supply and give each staff systemly training and on-site supervision and consistently improvement are critical important. Let's make sure each staff in the hospital is doing the right thing and on the right way. So, we have no single medical staff has been infected in the hospital. May next slide, please. How the coronavirus impact the medical service in the city or in the hospital? From this table, you can see the one big factor can be invited by the COVID-19 pandemic is outpatient and the inpatient dramatically dropped since COVID-19 pandemic. Next slide, please. Can I ask next slide, please? If you see this picture, you can see the pediatric service is mostly being impacted by the pandemic, by the virus COVID-19 pandemic. Or compare last year, no matter outpatient clinical and inpatient clinical, all the patient have patient's volume has decreased. Next, please. Next slide, please. The second issue that we are very concerned is vaccine. Have you seen this picture compare last year? And vaccine on the time, especially in February or in March, is 40% decrease. It doesn't mean the many of children in this city during the COVID-19 pandemic didn't get the vaccine on the time. So this is a critical issue that the government and the hospital concern very much. So the strategy that we have used is in May or in April that we solely reopen facility service to try to catch up with delay the dosage and the people. So until now, and each children can get a vaccine like hepatitis B and the measles and the polio and the schedule and the national guideline. Next slide, please. Compare children's service, but pregnant women's service seems less impact during the COVID-19 pandemic. Have you seen this picture that compare last year, the delivery are nearly same with last year. So in the hospital and the other hospital in the city to keep the delivery service is very necessary and essential. So that can meet every needs of pregnant mothers' need. May I next slide, please? The most concern for us in the past several months, we have nearly 100,000 pregnant women, and how we can distinguish, how we can screen and pick up a high-risk pregnant mother. That is critical and important issue we are concerned very much. So we have built this 3-level network, and we can screen each pregnant woman through the obstetrician hospital, community hospital, and the township hospital, and we're working with them very closely, and through 100,000 pregnant women, and pick up 500 pregnant women with high risk. They are either have some symptoms related with COVID-19, or either they have exposure history. So we have asked them to stay at home and isolate, and our medical team to phone them every day to make sure they can get basically medical service. If emergency or if they need a delivery, we refer them to the designated hospital. So that strategy are successful, and 5 pregnant women has been clinically diagnosed with COVID-19, and finally get a very good treatment. There was no cross-infection, no death, and no mother-to-children's transmission. So we are very happy with this result. Next slide, please. To supply the more service to meet the demand of patient. So we found a new way to open the internet service online for the maternity and the pediatric service. So through this app, and each citizen can reach our doctor and to get some consultant. Next slide, please. So, can I next slide, please? May I next slide, please? So through the app, and the doctor can provide some guideline and the consultant education, even some monitor like blood glucose monitor and fetal heart monitor and roommate at home. Next slide, please. So this is more be welcomed by the citizen. As you've seen this picture, in the last few months, we nearly have 32,000 visitors online. And we also deport more than 300 doctors standby and to provide more than 46 areas to consultant for the visitor. So the visitor can get free service. The doctor can get extra pay. So it's same OB, outpatient clinical online, and the fever clinical online is very popular and with this service. So may I next slide, please? This is only one part. And since pandemic a little bit slow down, how to resume the normal service is also important. The government and the hospital and provide many methods is like screen the patient and track the patient and measure the temperature and to make sure each visitor in the hospital to be safe. So to confirm give the visitor confidence. So through this effort, and right now we have quickly recover like normal compared last year. Next slide, please. Through our work, through our experience, I like to show some basically messages I like to show with them. And first, the government and hospital leadership are mostly very important, are critical. And the doctor, the nurse, and the staff, and all the suggesting and put all resources together and working together is also critical. Education and training each staff and each visitor to protect each visitor are also very important. That is what experience we like to show you. Thank you for your attention.
With your introduction, we can feel that every effort you and your team has made during the combat. The most encouraging sign is your quick response, your excellent echo and implementation of optimizing the operation of MCH service system to adapt to the changing situation. In fact, in recent years, our National Health Commission and authorities have kept on encouraging health providers to develop innovative internet-class health service. Owing to the energetic exploration and experiences accumulation, Guangzhou Women and Children Healthcare Center and many other hospitals can provide online MCH services via internet hospital and other diverse ways very quickly. This enlightens us the importance of strengthening provision of MCH services through different channels and platforms, even under the new normal. Once again, thank you, Chairman Xia. Then let me give the floor to Dr. Noble. He will preside the next half of the presentation segment, as well as the Q&A. Dr. Noble, please.
Thank you, Wang Jian, for your chairing of the first part of the seminar this evening. And let me add my welcome on behalf of the United Nations Children's Fund to everybody who's joined us this evening for this important webinar on universal health coverage and how we maintain services in face of COVID-19. But also how we tackle some of these difficult issues that we've been hearing about already this evening around pregnancy and newborns and health services and how we manage those in what is becoming for the world a new normal. I'm going to introduce our next two speakers in a moment, but I would like you all to be thinking about the questions and that you would like to ask afterwards. And it will also be very helpful to me if you can also indicate who you're going to direct the question to, and we'll help to do that after the next two presentations. So without any further ado, let me go on to the next presentation and to introduce our next speaker, Dr. Ying, the Director of Health Communication Center at the China Center for Disease Control and Prevention, where she is responsible for high-level design of disease control and science popularization, and highly experienced carried out more than 40 international and domestic cooperation programs, and published more than 70 peer-reviewed papers. So it's a real privilege to have you this evening, Dr. Ying, and over to you for your presentation.
Okay, thank you, Dr. Noble. Hello, everyone. I'm very happy to be invited by the UNICEF and the International Health Exchange and Cooperation Center of National Health Commission of China. Being the Health Communication Center of China CDC, we do have done a lot science information and risk communication. And I would like to share some information with you. Happy to learn the feedback from you. Next, please. The main contact I would like to give you are the following 4 aspects. There are risk assessment and monitoring, and the risk communication strategy, and risk communication impact, and one is conclusion. Next, please. Okay, for the needs assessment and monitoring, first, we must do the earlier attention and quick response. That's very important. And to find the needs of the public, to know what their concern and what they are most concerned. As you may know, I'm in the Health Communication Center, but I'm also in charge of the health hotline. The number is 12320. So we threw out 3 channels to communicate with the public. One is the health hotline. That means 12320 health hotline. And since December 31st last year, we have done 170 daily report of the health hotline. We collect the questions from the public and analysis, and then we give the answers to the public. People can call this number anytime. From this chart, you can see below this chart, we can see the high incoming call is on February 26th, is nearly 30,000. And also on June, 8 June, the total incoming call related to COVID-19 is near 3 million, around 17,000 daily incoming call that is related to the COVID-19. So we analyze these data and we summarize what the public most concerns, then we give the answers. And the second channel is social media platform. We use our Weibo and WeChat account that collect the common questions from the public. And the third one is the big data. We use the big data and to analyze the keyword that's searched by people online to understand the public concern and the topic, then the hot topic. Next slide, please. Okay, from this table, this chart show the analysis of the big data, and from this big data, you can see there's no significant difference on hot topics. That is the data, big data is on the first beginning. So all the public, they are concerning about the same, whether in the high, middle, and low risk areas. Next, please. And this video is from the health hotline. Then you can see the changes of the public's concern. In the first beginning, you will see most of the people concerned about is what are the clinical symptoms of the COVID-19, and they are concerning about what preventive measures are there, and also they have to ask how to wear a mask properly and where and how. In the middle phrase, the people focus on how to prevent it and how to deal with suspected cases. And also For the reopen phrases, cautions to take back to work and to resuming production and information about relevant policies. Most of the public, they concerned about this. Next, please. Okay. For the second part is risk communication strategy. And the number one is demand-oriented. First, demand-oriented, on this part, we have both sides to do. One is interfacing with the public. Another one is coordinating with the expert. That's very important. To the public, I mentioned we use the 3 channels to get the public concern and to collect questions and to give the answer. For example, the public will ask what should be paid attention when receiving express. So we collect the questions from the public. And another one is actively push information according to the needs of prevention and the controls. We provide knowledge that must be mastered by the public for prevention and control of the COVID-19. And in the other side, we're coordinating with the experts. We establish the working mechanism and experts team. So we ask the experts to give the right knowledge to the public. And also we form a closed loop cooperative approach of evaluation, generation, adaptation, and communication and redevelopment. And also we ask some experts to use their experts' knowledge and to teach the public. Next, please. And the number one risk communication strategy is accuracy. So health open our Weibo and WeChat public account of China CDC. You can see that our science population have pictures to read, a video, and experts to explain. We try to express the complicated knowledge in a language that ordinary people can understand and can read and can listen to. We try the best to provide the public with warm-hearted workers and appears the public's emotion on the premise of ensure scientific information in a short time. Next, please. And the health communication strategy 3 is to ensure the health of the pregnant women and the children. And we have fully cooperated with the UNICEF and have produced various forms of popular science works, such as videos and posters and pictures for maternal infant and school children. The popular science works have also traveled all over the world. According to our knowledge, many popular science works have been translated into English, Italian, Persian, Russian, and other languages, and spread to Cambodia, Indonesia, North Korea, Laos, Malaysia, and Thailand, and etc. So many countries. And the page views more than 130 million. Next, please. And the communication strategy 4 is to strengthen engagement with partners. So we have closed connection with the National Health Commission, and also we have the close connection with the Ministry of Foreign Affairs and the Ministry of Education. And also we have the connection of cooperation with some big platforms like Baidu, Ali, etc. And also we have the connection with South and South cooperation. Next, please. And this communication strategy 5 is feedback mechanism. And in this way, we have 3 methods. One is public, Just now I have mentioned a lot, like understand the public needs and communication effects through various channels. And the second one is experts, the timely interpretation of COVID-19 prevention and control measures. We send the experts to the press conference, live broadcast, television, and etc. to explain the prevention and control policy and answer the question to respond to the public concern. And the third one is media. We disseminate information on multiple platforms to magnify the communication effects. Next, please. And for the risk communication impact, from the January to April, during the 100 days, we've got 248 popular signs were published and read in Weibo and WeChat for nearly 200 million times. So you can see we have the special groups, pregnant women and children and the elderly, and the special places, for example, office, nursing home, and kindergarten, etc. to tell these different places they have how to prevent the COVID-19. Next, please. And during March to April, online surveys were launched through our official Weibo and WeChat platform to learn more about changes in public perception and behavior. So from this online survey, you can see over 90% of the respondents wear masks all the time when they go to the public areas. And also the number of people who wash their hands for more than 20 seconds is much more than before. Okay, next please. Next, please. And we also do some online survey for the behavior among the children's caregiver. And also we have investigated 1,325 gardens of children aged 5 and under. 95% of them regarded popular science information on prevention and control of COVID-19 released by CDC as help. The perception accuracy is high. And also you can see the rate of children's guidance, the caregivers' behavior, such as using hands sanitizer or these in hospital wearing masks and washing hands and changing clothes when they get home also increased. Next, please. And from this chart, you can see the awareness of behavior among the children's caregiver. Percentage of children's caregiver regularly disinfecting toys and tablewares increases, and also the percentage of those sharing tablewares with children, pulling the food with breath and chewing food to feed children increase. Next, please. This is what we have done in the online survey. Some data are still not analysis. Maybe later we can provide them more details. At last, I would like to give a brief summary. Then you can see the established monitoring system to accurately get the needs to of the public. That's a very important strategy. And also multi-format products, multi-channel communication, and multiple platform interaction to maximize the influence of reach of public health, the code message. And also the communication of public health information for pregnant women and children has improved the public awareness of protective measures and promoted changes in public behavior. And also the last one is leverage the big brand of the CDC through the small level of health communication and enabling environment for public health communication. So at the last, but not the least, what I want to say, emphasize. So during this period, I think there's a word we must know. What is the word that is infodemic? And it's getting more important. We should do more study of infodemic. The COVID-19 infection, outbreak, and development, all kinds of information related to the epidemic have aroused sustained, extensive, and high attention. Besides some facts, there are also personal opinions, comments, fake news, rumors, and anti-science, and even conspiracy theory. Moreover, these comments and assertions spread rapidly through various media and social platforms, leading to the outbreak of infodemic, causing individual harms and social harms, seriously impeding outbreaks control. So how to deal with this problem, how to cope with the infodemic? We should learn from the experience, the successful experience of infection disease prevention and control. First, purifying the information source and reducing spreading of fake information and fake news. Second, occupying main channel of information dissemination, cut off the transmission of false and wrong information in time, legally. Third, striving to improve public health and media literacy, enhancing the immunity of information epidemic. That was I emphasize. So before I finish the presentation, I would like to express our thanks to the UNICEF of China and for their strong support, and thanks to our efficient experts team and our staff. Thank you very much.
Well, thank you very much, Dr. Ying, and a hugely inspiring presentation on risk communication in COVID-19. And you may not realize, but we have large numbers of people on with us this evening from all over the world. And you have outlined a perfect scientific approach to risk communication and communication for development. You assessed the needs of the public and you responded to it in multiple different ways, different modalities, responding to those needs, triangulating with the experts. And then perhaps most impressive of all, you measured results in behavior where there was real change before and after. And so that was just excellent to hear that this evening. I'm sure will be a huge encouragement to many people who will want to learn more about it as part of China's international development cooperation, which UNICEF is very, very proud to be part of. Well, with that, let me move on to our next presentation this evening, where we are privileged to have the leading academician, Qiao from the 3rd Hospital to Peking University. Qiao and her team have made many landmark contributions to reproductive medicine in general, even before COVID-19. But during the pandemic, Qiao and team, they've led the National Medical Aid Team to Hubei province for Peking University, establishing critical care wards, ensuring the efficient and high quality operation of health services during the COVID-19 epidemic and then, of course, pandemic around the world. She's going to share with us on the health services management of pregnant women and children confirmed with COVID-19. I know there's a lot of anticipation for this presentation this evening. So without further ado, over to you, Qiao.
Okay, good evening and morning, ladies and gentlemen. Yeah, thank you for the invitation today. I want to share the topic of treatment experience for pregnancy women with COVID-19. Yeah, next slide, please. And next slide. And up to now, the pandemic situation around the world is still serious. There are more than 100,000 new confirmed cases every day. And next slide. Sorry, moment. Okay. And however, next time, no matter what stage of the epidemic, and Maternal as a special group of people who bring new life attract attention to the whole society at any time. And next slide, please. And as a leader of a medical term of Peking University in Hubei province and a specialist in gynecology and obstetrician, I hurried to pay more attention on maternal after the work of critical cases care was getting on the right track gradually. Next slide, please. And clinical characteristic of pregnancy women of COVID-19. And you can see, and before April, the situation in Wuhan is not positive. The number of cases of COVID-19 was large and rapidly rising every day. And besides, there are limited data about the clinical characteristic of pregnant women with the disease. So we have to investigate and summarize the situation under this epidemic, supported by the National Health Commission of China. And we published this data by the correspondents in the Journal of Medicine. And next slide, please. And from December 8, 2019 to March 20,000, we identified 118 pregnant women with COVID-19 in Wuhan. Among these, you can see 84 women, about 71% have a positive PCR testing. And remaining 34 cases, including about nearly 30% have suggested finding on CT of the chest, because this time is a very special condition at the very beginning. Next slide, please. The results show that pregnant patients represented 0.24% of all reported patients, and about 50,000 with COVID-19 at a designated hospital during this time. Next slide, please. And fortunately, among these 118 confirmed pregnant women, most of them had a mild disease. About 8%, 9% have a severe disease, hypoxemia. And the severe cases developed in 6 of the 9 women after delivery. They may pay more attention about that. Even most is a young woman, not serious for the cases. And the women who received non-invasive mechanical ventilation did so after delivery. That's only 1 severe case in Wuhan for the pregnancy woman. And as next slide, please. And during this time, 68 patients delivery, accounting for 0.56% of all 12,000 and 100, and you can see the 195 delivery in Wuhan. And there's one problem as about a little higher cesarean section rate. That's also the international obstetrician want to share the experience. Actually, now gradually we know the COVID-19 together with a pregnancy woman and can, depending the series of the condition of pregnancy woman to determine by vaginal or by cesarean section. But at the very beginning, because we have no much knowledge about that, so most patients do the cesarean section. Next slide, please. So according to our result, we found the risk of severe disease in pregnant population is 8% compared with favorable with a general population, about 15%. And the present data do not suggest an increased risk of severe disease among the pregnancy women. The third is exacerbation of disease during the postpartum are related to pathophysiology changing, and up to March 20th, 109 cases have been discharged, and was and also there is no deaths during this period. So, and through the news and article, we saw many cases of maternal deaths in other countries, and which really hard to think about that, and so it can be avoided in many cases if there is a chance prevention early. The next slide. So after we know the clinical characteristic of pregnancy women, the next question was the management and treatment experience for the suspected or confirmed pregnant woman. Next slide, please. And the most important task is to set up different isolation categories and designate hospital, provide medical service for uninfected or suspected and impacted women, pregnancy women during the different conditions. So we can see the how to home isolated for the designated hospital, and also for the regular prenatal examination, and also like suspended cases or confirmed mild cases, we can use a Fengchang Delta Hospital. And for serious cases, need to give pay more attention for the designated high-level hospital do that. And next slide, please. And there is one thing that difference between infected people and infected people. And the pregnancy woman would go in labor at any time or place. That means every hospital is not designated a place for COVID-19 treatment, have a chance to encounter an infected pregnant woman that need emergency delivery or the operation. So there is why we recommend every hospital to have emergency processing prepare for this special situation. And next slide, please. And before we encounter suspected and disconfirmed cases who cannot be transferred to designated hospital timely, we should prepare all isolated outpatients and inpatient area. Next slide, please. Well, we need to provide training and guidance for the all medical staff to ensure and their safety. That's very important. Also in Wuhan or in China now, in Beijing now, during the epidemic times, can control like the medical staff and the zero infection is important. Next slide, please. And as for the treatment of pregnancy women, we should be seriously evaluate gestational weeks and adverse effect of drugs on pregnancy women and fetus, and pay more attention on pregnant women with chronic disease, maternal complication, because underlying disease is important to relate the outcome of the any COVID-19 patient, including the pregnant woman. And there is no evidence to support the termination of pregnancy without medical indicators. But for pregnant women with severe or critical COVID-19, as preferred to determination of pregnancy, and the best choice is cesarean sections, because we need time to prepare for the serious disease development period. Next slide, please. And there is two drugs like alpha interference and leponavir mentioned in the Chinese clinical guideline for COVID-19 pneumonia diagnosis and treatment, the 7th edition. It should be noted that the use of alpha interferon in early pregnancy has the risk of hindering fetal growth and development. Besides the course of the leponavir treatment should not exceed 10 days. However, as relatively safety to use in the second or third trimester, actually some new drug gradually to use in the treatment for the COVID-19 also need more pay more attention for the times for the term for the pregnancy, because the early pregnancy is sensitive for the drug for the fetal development. So we need to pay more attention for the every new drug used in the COVID-19 treatment for the pregnancy woman. And to active all designation procedure fluidly to make sure nobody pandemic and forgot the procedure to then put everyone in danger of infection. Precaution drills and simultaneous access are very important. And next slide, please. Sorry, I forgot to say that. Yeah, so you can see that it's very, very important as infection control, because regardless what kind of delivery mode, vaginal delivery or cesarean section, the important thing is prevention infection for the patient and also including for the medical staff. Next slide, please. In terms of maternal and infant safety, the most concern is about whether the virus can be transmitted vertically. Next slide, please. And as at present, there is still two views. The first one is not sure for the vertical transmission from mother to baby. In one of the literature, there are nine confirmed pregnancy women in the third trimester. This I think is a very good study, because it's very early for the COVID-19 pandemic into and you can see all 6 new bone sample, including amniotic fluid, caul, bladder, breast milk, and throat swab test negative. At the same time, we comment that more definitive evidence is needed because at that very beginning of the COVID-19 pandemic, and every pregnancy woman worry about that and very, very nervous. So from the very preliminary data, we can see don't need to fear about that. We need to face it and to see what is the development. Next slide. And from the following study, you can see in other 3 studies, the results also support the view of not sure. And next slide. And also have some studies show maybe have possible availability. You can see this slide. The 2 studies reported that IgM and IgG antibody from novel coronavirus were detected positive in newborns. Since IgM antibody could not be transmitted from mother to fetus through the placenta, so this study suggested that there may be intra-uterine transmission will be happen, and also have some another comments for that, because considering IgG can protect the fetus through placenta, the neonatal condition may be better even have the virus, even have a virus infection. And the next slide, please. And also, because the IgM assay can be brought to false positive and false negative result, and so we need to more research about how about the vertical transmission. And also, there's one report showed the rapid decline reported in the patient for IgM. So the more definitive evidence is needed. Next slide. And how about the vertical transmission from mother to baby? And also like another question for the COVID-19 and the virus, how to affect the reproductive ability, need more clinical and basic study for the further research. Next slide. So finally, for the critical issue for protecting pregnancy early, most important as 4E and 4P, the early identification and early reporting, early isolation, and early treatment is more things. This 4E all is very, very important for the stop epidemic for COVID-19 infection. So also need to pay more attention for the pregnancy woman. And another important things for the protection, not only pregnancy woman himself, but also the family member and health worker. And also important things is for the environment, even hospital and home and outside of the hospital. So hope the everything is next slide. Hope the everything is better and everybody can united together to fighting the virus and protecting the health of the everybody. We working together. Thank you. This end of my presentation.
Well, thank you very much, Dr. Qiao. for that excellent presentation and for the incredible work you and your team have done. First, describing the clinical characteristics of pregnant women with COVID-19, publishing that in the New England Journal of Medicine, right at the basics of the science that we needed to start doing in COVID-19 are the basic clinical descriptions of symptoms and understanding the epidemiology, literally the disease amongst the people, to help us then tailor our responses both in China and in the international community. So thank you for that. And we will be sharing the slides and summaries of these presentations with everybody if you wanted to get into more detail on things like the isolation categories and the diagnosis and treatment for suspected cases. Thank you too for mentioning risk of vertical transmission. That was coming up in the questions, and obviously the data not sufficient at this stage, more evidence needed. One thing that UNICEF and WHO feel strongly about is that even though we need more research in this type of area, in infants the risk of COVID-19 infection is low. When it does occur, it's typically mild or asymptomatic. And we need to think about that when it comes to things like breastfeeding and separation of mothers from their infants. I'm going to move on to take some questions now. And the first question is for Dr. Wang AiLing. Dr. Wang AiLing, the question is, in light of the movement restrictions in China, how did China ensure continuity of provision of essential maternal, newborn and health services, especially for hard to reach and vulnerable populations and communities that would only usually get services through outreach or targeted health worker visits? How did we ensure continuity in those settings?
Okay, good question. I just want to give some answers on this question. Is even the question side is the movement resisting in Wuhan sometimes, but the connector is still existed. They can the pregnant women or children or their family, their parents could call the doctors in some ways, in WeChat, in telephone, in mobile phone is okay. We also have the Dr. Qiao side is some hotline to call the help. So it's normally there some normally a situation they can consultation from doctors online is okay, but for some special situation of some complications, some serious complications, they have to go to hospital. The hospital is open to them, and if the way they can go by themselves is okay. Also by some volunteer. Also some hospital can provide some cars to provide to pick up the patients is okay. This is okay. Yes.
Yes. Yes. Thank you. Thank you, Dr. AiLing. That's excellent. Let me ask the next question now to Dr. Huimin. And the question is, where was social assistance support provided to pregnant women during the lockdown? And was that linked to nutrition as well as other social assistance support for those pregnant women?
Thank you for your question. That is a really important, essential question for pregnant women. I think that is a critical time and very difficult for pregnant mother, and when the city is locked down. But we still have 3 ways to provide nutrition or any other service for them. The first thing, they can go to hospital on an emergency service, and if they have severe nutrition schedule, and the doctor stand by in an emergency service and can provide advice, or some specialists also can come in to working with our OB together and provide some suggestion for the severe nutrition schedule. So that is way always can be done. The second way, I think is common, as I have shown the slides. And if you have any question about related to the nutrition or any other need support, you can reach, you can get our consultant through the internet hospital. So that is a free service for patients. And also our specialist and our OB is very glad to provide some suggestion because they can get extra pay from hospital. So that is link is always existed from beginning of pandemic until right now. So as I have shown, it's more than 32,000 visitors, and the majority of them are pregnant women. So they have a concern, and they ask the consultant, so not only about nutrition and about ultrasound and etc. So that is way they can reach and get what they want to do. The third way that also is easy to reach through the WeChat counter or public WeChat counter or our website. They also can get some information is necessary for her to nutrition, psychiatry, etc. So basically service always there. The doctor is always there, and we can provide basically, maybe not fully service, but necessarily, essentially, and basically services is always provided by hospital or staff. So that is my answer. Is that meet your question? Thank you.
Thank you, Dr. Huimin. That's very helpful, I think, in tackling that complicated issue. The next question is for Dr. Qiao, a clinical question this time. As reported in Europe and America, there are a number of cases of pediatric multi-system inflammatory syndrome. Have you seen any cases of multi-system inflammatory syndrome here in China? Any idea of what the prevalence might be amongst child and adolescent patients?
Yeah, actually, I'm a gynecologist and not a pediatrics. I didn't see this kind of patient now in our hospital. I think maybe Professor Xia, do you know that?
Yes, I'd like to answer this question. Can I?
Yes, please do. Please do.
We didn't have found this kind of patient, but we realized when first case reported from Italian, from France, we have a review and our cases, and we have already picked up all multiple immune system and patients since January to March. There was more than 40 cases, but there was no single this kind of patient related with COVID-19 pandemic patients. It's not related with coronavirus infections patients. So that is very strange. We didn't have seen these kinds of cases not only in our hospital, and also other hospitals like Wuhan or some Shenzhen, and we have already contact with pediatrician. We didn't have found strongly relation with multiple immune system damage related with coronavirus infection. So
great, thank you for that, and I'm sure there'll be more work and research in that area. Dr. Qiao, I'm going to come to you with another clinical question here, and I hope this one will be more suitable. What about the usage of low-dose dexamethasone for pregnant women? Is that something that's being considered in the Chinese guideline, given some of the current evidence coming out from the Oxford group and such like? I think we just lost Dr. Xiaojie there, so I'm going to jump to another question and come back to dexamethasone if we get a chance to. Dr. Cui Ying, on risk communication, we had a question which was asking, did the number of questions reduce as the public got used to the situation? And did that lead to a need to reduce the number of staff managing the hotline service that you mentioned?
Okay, thank you very much for the question. What I mentioned just now is, yeah, as like the question mentioned, was is there any reason to reduce the number of staff managing the hotline service? Actually, for the staff of managing the health hotline, we have less people, and our health hotline is all over the 31 provinces. So the counselor is in the 31 provinces, and also they have they have their staffs. And during the COVID-19, there are some experts sitting in the hotline and picking the telephone and answer the questions, assisting the counselors. So now, according to the situation, now it's getting better, and also the experts, they can go back to their unit, and also the counselors, they will do as usual, because they are not only answering the COVID-19, they have many questions to have to answer. All that related to the health questions they have to answer. The COVID-19 is only one part, it's only part of them. I don't know it's clear or not.
No, I think it's clear, and thank you for that answer.
Yeah.
I'm going to jump back to Dr. Oh, go ahead.
You have the. I just see there's another question. Is the number of questions reduced, right? The
yes.
First question. There are two questions, and the first one is the number of the question is reduced. And actually, the number was reduced during last month, but since July is coming up again at the same level. So I think it's the same as before. So the staff, as they work as usual now. But the questions is different. As just now I mentioned, yeah. In different phrases, they are the public. They concern the different questions, but the number
but
now
the number is lower.
Now it's not going down. It's the average level.
Has it gone down? Has it gone down since the beginning?
I told the higher risk number is 28. I think 28,000, something like that. But now it's 22,000.
Okay, so maybe what we can summarize there is that the number has gone down a little,
yeah.
But the nature of the questions are changing, which is what I think I'm hearing from you.
Yeah, well, maybe they concern the different questions.
Yeah, different concerns, and I mean that would have relevance for people on the line tonight who are dealing with risk communication, because of course that tells us that we have to keep listening to the public and their needs in order to be able to respond to changes over time. Let me jump to the next question. Dr. Xia, I'm going to come back to you, Dr. Xia Huimin. A question about rural health facilities. You mentioned about the antenatal care clinics in your presentation, which was specific to tertiary and secondary facilities. But what happened in the rural areas? I mean, has it been possible to do separate antenatal care clinics in rural areas? I think you might be on mute there.
Thank you for this. Yes, thank you for this question. Thank you. I understand. And in the countryside or in the remote place, the maternity service and for the pregnant women is always there. So they can reach the community hospital, and they can get some consultant from the local community hospital and the doctor as well. That's one way. The second way, they can also reach a high tertiary hospital, the specialist through the internet. So even like in my hospital, and they also can refer the the fetus heart rate and blood glucose level and to our doctor, and can get some suggestion and can get some consultant through the internet. So those two ways for the pregnant women, even in the countryside, or no matter they are in the mountain or in the river or close to the ocean, they always can find the OB doctor. Doctor is there, service is there. So that is what I answer. Thank you.
Okay, thank you. Thanks, Dr. Huimin, for that. I'm sure that will be helpful. I don't know, just as a last question, Dr. Qiao is not going to be able to join us again due to connection issues.
Now I'm here. Now I'm
You're here. You're back.
Yes.
Oh, I'm very glad.
Yeah,
I didn't want the participants to. Right, I didn't want the participants to leave empty-handed on this question about dexamethasone. So I wonder if you could give us some insights on dexamethasone use in pregnant women in China, given the evidence coming out of from the Oxford group.
I'm sorry. Yeah, you can ask again.
There's some emerging global evidence around use of dexamethasone in pregnant women. As relates to COVID-19. Is that one of our participants is asking, is that something that's being used in China or that guidelines are advocating?
Yeah, actually, the pregnancy woman after the Wuhan pandemic, no new cases arriving. So yeah, there is no more experience for that. Yeah.
Okay. That I can, yes. Do you have a personal professional view on the use of dexamethasone in pregnant women with COVID-19, given that other countries around the world have been looking at this as a possible treatment? If you don't, then
yeah, actually, in Wuhan we used another hormone, yeah, for the treatment for the general patients can see some results, not used in the pregnancy women for the dexamethasone.
Okay. Well, thank you, Dr. Qiao, and everybody else on the panel for both your presentations and answers to questions this evening. I'm going to just make a few remarks to close with and then pass to my co-chair for her closing remarks. I think it has been very useful this evening to hear about the experiences in China with pediatric patients, with pregnant women, with health service design, with communication for development. And I've certainly been reminded of the huge importance of maintaining routine health services despite COVID-19. Those figures that we saw on declining routine immunization rates are very worrying in China, but they're also very concerning in many other countries as well. And we need strong communication for development and risk communication so that we can tackle the fear in many countries associated with attending health services to get a simple immunization or to attend an antenatal clinic. We also need, as health service leaders, to be able to design health services so that we can inspire confidence in the public that they are safe to go to for antenatal, for postnatal care, and for other health services. We also need to make sure that we, through our efforts to contain COVID-19 and to treat it, that we don't inadvertently do more harm than good. That's one of the things we all feel strongly about as doctors, that we never do more harm. And that, you know, there are areas that have been a real challenge for many of us globally in many countries, given a lack of evidence. Currently, UNICEF and WHO, for example, are recommending that mothers with suspected or confirmed COVID-19 should be encouraged to initiate and continue to breastfeed for 6 months as per guidelines, and then for longer with complementary feeding. That's because the benefits of breastfeeding substantially outweigh the potential risks for transmission. Obviously, safeguards have to be taken in a situation like that, but I give the example just to say that we need to keep thinking on the front line about these issues so that we don't do more harm than good. It also affects other public sectors. All over the world, we've closed schools in many, many countries, yet there's very limited, if no evidence, that localized transmission happens between children in schools. We heard very interesting data about it in pediatric settings this evening as well. China's been a real leader in getting schools open again, and that's another issue separate from this evening's issue, but also reminds us the importance of maintaining routine public services, be that healthcare, education, or social services. We've also got a great opportunity for South-South cooperation, and we've had many people on the webinar this evening from various countries around the world, from Africa and from other places. And I know that UNICEF and CDC and all of our partner organizations are very willing to work in partnership with other countries to share experiences and to help other countries respond to COVID-19. So with those closing remarks, I will pass to my co-chair, Ms. Wang Jian, to close the evening.
Thank you, Dr. Noble, for your professional presiding and constructive and inspiring summary. Currently, the pandemic is still lingering around and raging on the whole world. China got the pandemic under control through extremely painful effort at an enormous price, but still face the risk of rebound, so MCH service providers still have a long, rough way to march on. We are in the same boat and have to shoulder the responsibility together by closer multilateral cooperation. The Chinese government prioritizes contribution in global MCH governance, and will do our utmost in building the community of a shared future for mankind. Here, I'd like to take this opportunity to announce the Belt and Road MCH collaboration platform. You can see it on the screen, established by my center and UNICEF China. We do hope to expand partnership by this platform, which is demands-oriented, integrated best resources from home and abroad, with an integration of on and offline service. We aimed at building a long-term communication platform for partners to address challenges, share experiences, and learn from each other, where we can enter a beneficial cycle of summarizing, learning, practicing, evaluating, sharing, improving for mutual development. The platform will be launched in early August. Please stay tuned and apply to launching your collaboration initiatives. Pity to say time is to draw the closure. And again, thank you all for your support and participation. The next webinar of the Response to COVID-19 series will take place on Tuesday, July the 7th, which will focus on the adoption of cash transfer in Latin America. Don't forget to register on the chat box. Please join the related online community to learn more. Thank you all. That's okay, thank you.